Hello and welcome. My name is Rebecca Preza, and I am the healthcare facilitator at UC Santa Barbara. And in this video, I will be covering the UC medical plans and comparing them for the 2021 plan year. This presentation is intended for communication purposes only, so please visit the UCNet website and plan documents for complete information. Some excellent resources that are available to you during the open enrollment period is, of course, our open enrollment website and as well as the UCNet. Both of these QR codes will take you respectfully to those pages so you can access additional forms and documentation following everything that we've covered in this video. Another great resource is the Which Medical Plan is Right for You. This booklet is available online in various layouts. Most of the content I cover in this video, including the plan premiums, deductibles, copays, coinsurance, and out-of-pocket maximums, can be found in the Which Medical Plan is Right for You. In this video, we will cover your priorities, your resident limitations, choice of doctors, costs of care and prescription drugs, out-of-pocket maximums, the health savings account, behavioral health, and chiropractic and acupuncture. So thankfully for 2021, we aren't expecting any major changes. So all of our medical plans will continue in 2021. Our HMO plans will be UC Blue and Gold and Kaiser HMO, and then our PPO plans, which are all administered by Anthem Blue Cross, will continue to be the UC Care, Health Savings Plan, and Core. There are changes in the employee medical rates. So here is a screenshot of the 4 different pay bands. Please note that if you are part of a union, your rates may vary. So please contact your union rep directly or reference your union documents to see what your new 2021 employee contributions will be. So all of the UC medical plans have similar coverage. Each of them have a bundled medical, behavioral health, and prescription drug coverage. Additionally, all of our plans cover preventative care at no cost. So that means anytime you go in for an annual well visit, well woman visit, preventative screening, and lab work, as long as you use an in-network provider, the cost to you is zero. Oftentimes people aren't entirely sure where to start. So one of the things I like to help people understand is their priorities. What is your priority for enrolling in one of these plans? Is it the cost to enroll? That means your monthly premium, what's going to be deducted directly from your paycheck. The cost of care, how much are you willing to pay for services? Do you want predictable low cost copays? Or are you willing to pay a percentage of each service? Choice of providers. With an HMO plan, you assign yourself to a primary care physician who's contracted with a medical group. Whereas with a PPO, you have a preferred network, or you can select any provider. And then effort to manage your care. So do you want to be the one to coordinate and manage the bills that come in to ensure that they are being processed correctly and that the insurance is paying their percentage? Or would you rather it be your medical group, your provider who's managing those claims on your behalf? So there are resident limitations depending on which plan you elect. So here are some things to keep in mind. For the UC Blue and Gold and Kaiser HMO plans, the employee must live in California, and your primary care physician or medical group must be within 30 miles of where you live or work. For the health savings plan, the employee must live in the US, whereas the UC Care PPO and the core PPO plans, the employee may live anywhere, and each of these plans offer worldwide services. So your choice of physician is also going to vary depending on which plan you elect. For our HMO plans, HealthNet and Kaiser, you must select a primary care physician. Once you select your primary care physician, they are going to be the ones to coordinate your care and refer you out to specialists. And then any specialists that you are referred to are going to be limited to the physicians that are part of your medical group. For the UC Health Savings Plan, you have the option between in-network Anthem preferred providers or in out-of-network is anyone who's not contracted with Anthem. For UC Care, your in-network providers will be your UC Select and Anthem preferred providers, whereas your out-of-network providers, of course, are going to be anyone who's not contracted with Anthem. For core, your in-network provider is going to be Anthem preferred, whereas you also have the out-of-network benefit, and that is anyone who's not contracted with Anthem. So let's take a moment to look a little bit more closely at the UC Care PPO tiers. UC Select Tier 1 and Anthem Preferred Tier 2 are going to be your in-network providers. Your UC Select Tier 1 providers are UC Medical Centers and Select Anthem Preferred providers who are contracted under the UC Select Tier 1. For Anthem Preferred Tier 2 in California, that's going to be your Anthem Preferred providers. If you're outside of California, it's going to be Blue Cross Blue Shield providers. And if you're out of the US, it will be Global Core. And then, of course, your Tier 3 is your out-of-network providers, and that is anyone who is not contracted with Anthem. So your UC Select or Anthem Preferred, if they're not contracted under those tiers, or contracted under the Blue Cross Blue Shield or Global Core are considered out-of-network providers. UC Select in Santa Barbara. So UC Select, which is our Tier 1, will be limited to Sansum Clinic, the Cottage Hospitals, Quest Diagnostic, Pacific Diagnostic, Pueblo Radiology, and then you can also search additional Anthem UC Select providers via the Anthem directory. So the list here again is limited. It does not include all UC Select providers. You can actually search more providers, local providers via the Anthem directory. As I mentioned in the previous slide, there are additional UC Select Tier 1 providers locally in the Santa Barbara and Ventura counties. So you can search again those UC Select providers via the Anthem directory or by contacting the Anthem Health Guides. When traveling outside of the US, each of the UC medical plans provide a certain level of coverage when traveling outside the US. For our HMO plans, HealthNet and Kaiser, as well as the Health Savings Plan, you are limited to emergency and urgent care when traveling outside of the US, whereas the UC Care and Core plans do offer worldwide coverage. That means that under the UC Care PPO plan, Anthem will cover services outside the US at the Tier 2 Anthem Preferred and Tier 3 out-of-network level. And for the core plan, Anthem will pay at the in-network and or out-of-network level. Let's take a moment to look a little bit more closely at the terminology for plan costs. HMO plans do not have a deductible and you pay co-pays for services. This means that there is a fixed rate for each service that you receive. And the plan cannot charge beyond that rate. Whereas PPOs have deductibles and coinsurance. A deductible is the amount you have to pay each year before the plan starts sharing the cost with you. Once you've hit your deductible, then the coinsurance will kick in, and this is your share of the costs after you've met your deductible. Your costs under PPOs are based on the network the provider is in and the service you receive. You pay discounted rates for in-network providers, and you can expect to pay more for out-of-network providers. Under the PPO plans, Anthem negotiates allowed rates to process claims. This is a discounted rate, which is an amount each plan negotiates with the preferred or participating providers. You pay the in-network coinsurance on the discounted rate, and the provider cannot balance bill you the difference. When using out-of-network providers, Anthem assigns allowed rates to process claims. That means when a provider is out of network, they are not subject to the discounted in-network rate. Anthem will pay at the out-of-network coinsurance on the assigned amount, and then the provider can balance bill you the difference. Each of the UC medical plans have an out-of-pocket maximum, which helps limit your financial liability per year. This means that in the event you were to experience a catastrophic event, you are not slammed with a $100,000 bill at the end of the year. The out-of-pocket maximum is the maximum amount a plan requires an individual or family to pay in a calendar year before the plan pays 100%. The out-of-pocket maximum does include copays, deductibles, coinsurance for medical services, behavioral health, and prescription medication. These tables show the individual and family out-of-pocket maximums for the 2021 plan year by medical plan. Let's take a closer look at the out-of-pocket maximum for the HealthNet HMO and the Kaiser HMO plans for an individual and a family. So as you can see from this chart, for the HealthNet HMO plan, the out-of-pocket maximum for an individual is $1,000, whereas for a family of three or more, it's $3,000. For the Kaiser plan, the individual out-of-pocket maximum is $1,500, whereas for a family, which is equal to two or more, is $3,000. Again, once you've met this out-of-pocket maximum in the plan year, the insurance will pay 100% for the remainder of the year. Let's take a closer look at the out-of-pocket maximum for the UC Care PPO plan. UC Care again has three tiers: UC Select, Anthem Preferred, and Out of Network. Each of these tiers have their own out-of-pocket maximum. The UC Select and Anthem Preferred tiers out-of-pocket maximums do cross-accumulate, whereas the out-of-network out-of-pocket maximum is completely separate. The medical, behavioral health, and pharmacy benefits are combined, and the UC Select Anthem Preferred pharmacy and behavioral health expenses will accumulate toward the UC Select out-of-pocket maximum. In this example, I am showing you how the UC Select and Anthem Preferred out-of-pocket maximums cross-accumulate. So anytime you receive services within the in-network tier, all the services will apply towards both your UC Select and Anthem Preferred out-of-pocket maximum. Once you've hit your UC Select out-of-pocket maximum of $6,100, anytime you use a UC Select provider, the plan will pay 100% after that. Then you will continue to work towards the remainder of the out-of-pocket maximum for the Anthem Preferred of $7,600. So that difference would be $1,500. You continue to accumulate that remaining balance with Anthem Preferred providers until you've hit that $7,600 out-of-pocket maximum, and then the plan would pay 100% after that. Let's look at the out-of-pocket maximums for the Health Savings Plan and Core. For the Health Savings Plan, you can see you have two out-of-pocket maximums that must be met when you're using Anthem Preferred or out-of-network providers. For Anthem preferred providers, the individual out-of-pocket maximum is $4,000 and the family out-of-pocket maximum is $6,400. When you are using out-of-network providers, the individual out-of-pocket maximum is $8,000 and the family out-of-pocket maximum is $16,000. For the core, the out-of-pocket maximum when using both Anthem preferred and out-of-network providers is $6,350 for an individual and $12,700 for a family. Again, your medical, behavioral health, and pharmacy are combined in the out-of-pocket maximums. Your in-network expenses will apply to your out-of-network deductible, and the full family out-of-pocket maximum must be met before the plan pays 100% for any family member. This is an example of how the deductible, coinsurance, and out-of-pocket maximums apply with health savings plan members with using in-network providers. So for both the individual and the family deductible, the full deductible must be met before the plan is going to start sharing in the cost of services. So if you are an individual on the plan, you must meet your $1,400 deductible first before the plan is going to start co-sharing in the cost of services. Additionally, if you are a family, the full $2,800 deductible must be met before Anthem is going to start co-sharing in the cost of services. Once that deductible has been met, then Anthem would pay 80% and you pay 20% coinsurance until you've reached your out-of-pocket maximum. Again, your deductible applies towards your out-of-pocket maximum. So the $1,400 deductible for the individual or the $2,800 deductible for the family will apply towards your out-of-pocket maximum. The UC Health Savings Plan is a high deductible medical plan paired with a health savings account. This is the only UC medical plan that meets the IRS requirements for a health savings account. That said, the health savings plan is a two-part plan. The medical component is administered by Anthem Blue Cross, and the health savings account component is administered by Health Equity. Feel free to take a moment now to scan the QR codes to visit the Health Savings Account plan on Anthem Blue Cross and the Health Savings Account plan via Health Equity. There are a number of benefits and advantages of having a health savings account. With a health savings account, you can keep the money even if you change jobs or insurance plans. You can make contributions at any time. You can increase or decrease your contributions throughout the year. And the health savings account has triple tax advantages in which there are no federal taxes on contributions, no taxes when funds are used, and no taxes on earnings. Your HSA funds roll over from year to year, and you can invest your funds to earn more. You can use your health savings account to pay for deductibles, coinsurance, any IRS publication 502 expenses, including medical, dental, vision, prescription drugs, and long-term care premiums, and you may also pay expenses for tax dependents that don't have to be enrolled in your medical plan. Finally, you can also use your HSA funds to save for retirement. If you are enrolled in the health savings plan as of January 1st, 2021, the UC will contribute $500 to an individual HSA or $1,000 to a family's HSA. This contribution is to help provide you a jumpstart on your overall healthcare costs and needs for the year. You can then contribute anytime up to the IRS limit. The 2021 IRS max for an individual is $3,600 and $7,200 for the family. You do want to keep in mind when calculating your HSA contributions, that you do take into account the UC contribution to ensure you do not exceed the IRS limit. Finally, if you are 55 years or older, you are eligible for a $1,000 catch-up contribution. Your contributions carry over year to year and they stay with you even if you leave the UC, and you can increase or decrease your HSA contributions via UC Path at any time. Before enrolling in the health savings plan, there are some things you have to consider in order to own and contribute to the health savings account. You cannot be enrolled in Medicare's Part A or B. You cannot be enrolled in other medical plan. You must have a $0 balance in your health flexible spending account as of December 31st, 2020, and you cannot be claimed as a dependent on someone else's tax return. Let's take a closer look at an office visit. For our HMO plans, UC Blue and Gold and Kaiser, these plans do not have a deductible or coinsurance. Instead, you pay a $20 copay for each office visit. Under UC Select Tier 1 of the UC Care PPO plan, you do not have to meet a deductible and you do not have coinsurance. Like the HMO plans, you also pay a $20 copay under UC Select Tier 1 for each office visit. Whereas under the UC Care PPO Tier 2 and out-of-network Tier 3, you must meet your in-network or out-of-network deductible before Anthem begins co-sharing in the cost of services with you. As you can see, the cost breakdown remains the same for hospital and outpatient surgery for our HMO plans. Under the UC Blue and Gold and Kaiser plans, you will pay a copay for a hospital visit or outpatient surgery. Under the UC Select Tier 1 of the UC Care PPO plan, you will also pay a copay for these services, whereas you must meet your deductible first under Anthem Preferred Tier 2 and out-of-network Tier 3 before Anthem co-shares in the cost of services. For an emergency room visit, you will pay a $125 copay under the HMO plans UC Blue and Gold and Kaiser. This copay is waived if you are admitted. Under the UC Care PPO plans, Tier 1, 2, and 3, you will pay a $300 copay or a $250 copay if admitted. Since core and the health savings plans are high deductible PPO plans, you must meet your deductible first before Anthem will co-share in the cost of services. Once your deductible is met, your coinsurance will vary depending on whether the provider is an in-network provider or an out-of-network provider. As a reminder, you will get more bang for your buck when using in-network Anthem preferred providers. For an emergency room visit, again, the cost breakdown remains the same for the core and health savings plan in that you must meet your deductible first before Anthem begins co-sharing in the cost of services. For prescription medication under the HMO plans UC Blue and Gold and Kaiser, as well as the UC Care PPO plan, you will pay co-pays for prescriptions. Under the health savings plan and core, you pay a discounted rate until you've satisfied your deductible. After your deductible has been met, you pay 20% at preferred pharmacies. Here are some additional resources where you can learn more about PPO costs. Each of our medical plans offer behavioral health coverage, and the medical plan you elect will determine your behavioral health provider. A referral is not required when accessing behavioral health services. The in-network behavioral health provider for the UC Blue and Gold HMO is Managed Health Network, MHN. For Kaiser, you have the option between Optum Behavioral Health or Kaiser Behavioral Health. In this video, I will be focusing on the Optum Behavioral Health benefits under the Kaiser plan. And then Anthem is the in-network behavioral health provider for our PPO plans, UC Care, Health Savings Plan, and Core. Under the HMO plans in Tier 1 and Tier 2 of the UC Care PPO plan, the cost for the first 3 visits is $0, and then you'll pay a $20 copay starting at the fourth visit with in-network providers. Under the Health Savings Plan and Core, once your deductible has been met, Anthem pays 80% and you pay 20% coinsurance with in-network providers. Each of our UC medical plans also offer telehealth services. The medical plan you elect will determine your telehealth provider. You can access both board certified medical and behavioral health providers, and the cost for telehealth services will vary by plan. Under the UC Blue and Gold HMO plan, the telehealth provider as of January 1st, 2021 will be Babylon. They will be replacing Teladoc. Under Kaiser with Optum Behavioral Health, it's One Doc Way. And under the UC Care Health Savings Plan and Core, it's Live Health Online. You also have specific providers for chiropractic and acupuncture care. American Specialty Health is a chiropractic and acupuncture provider for the UC Blue and Gold and Kaiser. This service is self-referred and you are limited to 24 combined visits in a plan year. Under the UC Care PPO, Anthem is your in-network provider. Chiropractic and acupuncture care is not available at the UC Select Tier 1. However, it is available at the Anthem Preferred Tier 2 and out-of-network Tier 3 levels. Like the HMO plans, you are limited to 24 combined visits in a calendar year. Under Core, Anthem will continue as your in-network provider and you pay 20% coinsurance after you've met your deductible. Again, like the previous plans, your benefit is limited to 24 visits per calendar year, and they are combined for both acupuncture and chiropractic visits. And finally, under the health savings plan, Anthem is your in-network provider and you pay 20% coinsurance after you've met your deductible. I'd like to take a moment to briefly highlight all the open enrollment resources available to you. As many of you know, the UC Virtual Benefits Fair is where you can attend plan-hosted webinars, ask questions, and virtually connect with plan administrators. The UCNet Open Enrollment website is also available for accessing and reviewing open enrollment plan documents, changes in 2021 plan cost. UC Path is where you'll need to go to submit your open enrollment changes. If you have general open enrollment or benefits questions, you can submit a ticket through the HR service now. And finally, you can access and review recorded videos via the UCSB Healthcare Facilitator YouTube channel. Let's continue to stay strong and stay healthy.